So next we will discuss what is conflict of interest. So what is conflict of interest? So what is conflict of interest, doctors? So conflict of interest is when a secondary interest of financial, personal or professional could influence or be perceived to influence a doctor's judgment, decision, or actions. Actual harm does not need to occur. Okay, if there is any conflict of interest, like not always there should be actual harm, right? If they are like having some secondary interest, that is conflict of interest. Okay, influence or perceived influence is enough. So, what are the type of conflict of interest? So, financial conflict, personal conflict, professional conflicts, and conflicts interest in clinical practice, and conflicts interest in researchers. So, let's discuss about one by one. So, what is a financial conflicts? So, financial conflicts mean payments, gift, sponsorships, travels, um, then financial interest related to the patient's care or research. So personal conflicts, treating family members, close friends, or having personal relationship that affect objectives. So usually, so basically in Australia, we can't treat our own family, right? It's a conflict of interest that can trigger conflict of interest. So yeah, according to ethics. So remember that one, okay? Yeah. Then professional conflicts, dual roles such as clinician and researcher, supervisor and assessor, pressure for promotions or publications, recruiting own patients or students. Okay, it's a professional conflict. That conflicts interest in clinical practice. So, what is this? Occur when personal or financial interest may affect the clinical judgment, referral, or prescribing. As example, uh, prescribing a drug while receiving a benefit from the manufacturer, right? It's a good example. So, what's in the research? Occurs when funding, personal gain, or role relationship may be affect study design, consent, and data analysis or reporting. So, this affect by example, a researcher funded by a company whose product is being studied, right? So, in a case of this case, so pay this doctor should disclose, right? How all actual potential or perceived conflicts must be disclosed to patient, employers, ethic committees, and in the publications. Like if you are doing research and if some institution, some company or pharmaceutical company is offering you like offer it like they ask you to fund for that research, in that case you should disclose everything, disclosure to everything to all other all other participant, even for these patients who are participating in the research, as we have to disclose, right? Yeah, because it's a conflicts of interest in research, right? So how we should manage conflict? Conflicts must be actively managed through the independent consent process, supervision, exclusion from decision making, or transparency. So non-disclosure mean like as in this scenario, if the doctor is not disclosing these things, that trigger the conflicts of interest, right? So yeah, we'll do a question. Okay, I'll read the answers later because I got these questions from my notes. Okay, that's why they have marked and they are very old, right? Because for some topics I have collected some questions for ethics. That's only one questions, one or two. So the question is, 1 minute. The question is, a medical researcher is planning a clinical trial to evaluate a new treatment for psoriasis. The study will involve 200 participants and is partially funded by pharmaceutical company that manufactures the drug being tested. The researcher owns shares the company. Which one of the following represent the most appropriate management of the potential? So number one, disclose conflict of interest to all relevant participants. Number two, disclose share ownership to the ethics committee only. Cancel the research project due to the conflict. So what do you think? Answer me from these three. First one, disclose a conflict of interest to all relevant parties. Second one, disclose share ownership to the ethics committee only. Third one, cancel the research project due to the conflict. So what do you think? Good. All parties, right? We just read it here. Disclosure, all actual potential perceived conflicts must be disclosed to patients, employers, ethic committees, and all the publications as well, right? So the answer is disclose conflict of interest to all relevant parties. The correct approach is disclose conflict of interest to all relevant parties. This includes the Human Research Ethics Committee, study participant, and any subsequent publications. While having shares constitutes conflicts of interest, it does not automatically invalidate the research or if the properly disclosed and managed. Then, so the incorrect options can be explained. Let's see why. Cancel the research project due to the conflict. Having a conflict of interest does not automatically preclude conducting research if appropriately disclosed and managed. So that's why in that question in that theory part also you write here under research, the main thing that you can do is disclosure to everyone, right? Then we can manage it. Then what else? Disclose share ownership to ethics committee only. No, disclosure must extend beyond the just ethics committee to include participant and publications. Sell shares before submitting ethics application. This is anyway wrong. Transfer shares is this also wrong, right? So transparency about conflict of interest is essential for the maintaining research integrity and public trust. The existence of conflict does not necessarily compromise the research, but failure to disclose it does. So what we should do? We have to disclose. We have to maintain the transparency, right? We have to inform everyone. So conflict of interest research must be disclosed to ethics committee participants and publications. Share ownership in companies related to research constitution is a significant conflict of interest that require disclosure. So hope you understand this topic. Do you understand it? Do you have any problems? So you can just ask.